because if your head is spinning, you can easily lose your balance and your footing and take a tumble. Now, sometimes dizziness is a symptom of an underlying medical condition. It could be high or even very low blood pressure. It could be heart arrhythmias or even anxiety. But sometimes it stems from damage to the inner ear, which is where the delicate organ of balance is located. And in today's programme, it's these balance disorders of the inner ear that we're focusing on. Conditions such as labyrinthitis, positional vertigo, and Ménière's disease. Some of these conditions, as you may well know, are easier to live with than others. Some are more treatable. But there's always something to be tried. So if you'd like advice or information, call us now. 08700 100 444 to speak to our expert today, who is Dr Rosalyn Davies. She's a consultant in audio-vestibular medicine at the National Hospital in Queen's Square. I have to say, Rosalyn, before preparing for this programme, I didn't really know that there was such a thing as audio-vestibular medicine. Can you very briefly explain what that actually means?
Yes, of course. It is the specialty of hearing and balance, and we are physicians rather than surgeons, so we don't operate. We like to investigate and diagnose our patients and manage them thereon.
At a balance clinic?
At a balance clinic, ideally, yes.
OK, well, there are plenty of people who would like to speak to you about their problems with dizziness and balance. And Mr Vang is first up. Dizziness and vertigo since, 1971. That's a very long time. So you've been struggling a little bit with this, have you, Mr Vang?
It's just Vang. I don't use prefixes. Over the years, I've come to terms with handling it, the varying different kinds of dizziness I have. It initially started off with vertigo, and this regularly the most common cause of the bouts is vertigo, but I have experienced a wide range of complaints that cause dizziness and vertigo. One of the most frustrating things being that the majority of them just don't know what the hell the cause is.
So you struggle and other people just look on and don't quite understand what you're going through.
Well, that is a major problem. Unfortunately, ever since Alfred Hitchcock brought out Vertigo, the second you mention Vertigo, everyone thinks fear of heights, which is not.
Absolutely. Well, let's get Rosalyn to comment on that. We are using these terms, vertigo and dizziness. Are they entirely interchangeable? And in a way, how can you explain to people what you're going through, how unpleasant it may be?
It is a very difficult symptom to describe. In the medical world, we use vertigo to mean an illusion of movement. However, the word dizziness encompasses a lot of other sensations like lightheadedness and muzziness, as well as vertigo itself. Yes, it is a very disorienting symptom, and it's very difficult to explain to other people.
And vertigo, as in fear of heights, doesn't really come into the picture?
The fear of heights is what we call physiological vertigo. We all get it if the conditions are extreme enough. Most of the patients we see with dizziness and vertigo have what we call pathological causes for their vertigo. There's some disorder that's underlying their symptom.
Well, thanks for putting the question and helping us define our terms a little bit, Mr Vang. If I may, though, I'd like to go on to our next caller, Jane Bayliss, who... well, she uses the term dizziness, which is due to your neck position while you're asleep. So how uncomfortable is this, Jane? And is this something that's come on recently?
Well, no, I've been suffering from this for 6 or 7 years. I occasionally, very occasionally, wake up in the morning with dizziness that can last all day. My blood pressure is fine. But I started to suffer neck stiffness on waking a few years ago and changed to an orthopaedic pillow, and that helped greatly. But I was wondering if there could be a connection between my neck position while sleeping and the dizziness, because it's also occurred after painting a ceiling.
Now that has made my guest's eyebrows shoot up when you talk about painting a ceiling. What are you thinking, Rosalyn, in this case?
Yes, indeed. Yes, indeed. Hello, Jane.
Hello.
The painting in the ceiling does make my mind immediately jump to one particular cause of vertigo. There is a particular head position that can trigger dizziness and is caused by a condition that we shorten to the term BPPV, benign paroxysmal positional vertigo. And it's very characteristic, this particular condition, in that people have a spin, which is really quite short-lived, less than a minute, when they turn themselves onto one side in bed, or indeed in slightly other unusual situations, if they're changing a light bulb from a ceiling lamp, or if they're looking up at an air show, for example, and they've held their head back for a long period of time. The reason also for my eyebrows shooting up is simply that it's a very treatable condition, and we can give a manoeuvre which dislodges the crystals which have accumulated in the back canal of the balance organ in the inner ear and redistribute them so that they no longer cause the problem.
Now, I've heard this manoeuvre described as quite miraculous. It completely gets rid of this horrible dizziness for people. Is that right? Is it that simple?
Well, it is very satisfying for the doctor to suddenly have a patient who describes the characteristic symptoms. There are two manoeuvres that we frequently use for this condition, and both of them have a 70% success rate. And when I say success, I mean cure. And one of them is the Epley manoeuvre. Jack Epley from the States devised this, and it was first published in 1989. And the other is by Alain Samont from Paris in France, and was described in the very early 90s. I think they are both as effective as each other. Just depends what your particular practitioner is used to doing.
Jane, stay with us, but let me bring in Jack Harper, who's in Northern Ireland. I think also with a question about, indeed, what might be this positional vertigo that we're talking about. Is that something that you've been diagnosed with, or something you may be affecting you, Jack?
No, it was something I was actually diagnosed with about 10 years ago. And I discovered on my own during the course of experiencing these bouts that if I slept on one side only at night, that is in fact my left side, and not my right side, I could keep the vertigo at bay. If I turned over in the night or during the day or whatever and slept on my right-hand side, the bout would last for not only the whole day, but perhaps even for weeks. So I've learned to lie only on my left-hand side. My problem is that I don't get a full night's sleep. Now, if you can return to me my full night's sleep, I'd be very grateful.
And if I can throw in yet another, because I think this is obviously, we've touched a nerve here. An email has just come through from Christine Cotton, who says that her 23-year-old son suffers from severe dizzy spells which wake him up during the night. He says that sleeping with 2 to 3 pillows helps him, but wonders if dehydration is a factor. And obviously he would like to get a good night's sleep just as you would, Jack. So some general advice then for people with these kind of symptoms.
I think you need to go to your local balance unit and ask to be diagnosed as to whether you might have BPPV, benign paroxysmal positional vertigo, as this is the condition that can be so easily treated.
Jane, is that something, if you're still with us,
yes,
advice you'd like to follow up?
Yes, I would, certainly.
Well, a miracle cure would be good, wouldn't it?
It certainly would.
And, I mean, just because it's so intriguing, can you say a little bit more about what's going on inside the inner ear? Do we actually know when people have this condition? And you've talked about people striking certain poses, painters. I've heard people, yes, cameramen, for example, in the media, get the problem too. So what is going on to cause it?
It's due to loose chalk crystals, which, when they're in the right place within the inner ear, are very helpful, and they're part of the sense detector mechanism for our balance. However, it's quite easy to dislodge them from the jelly membrane on which they sit, and a mild bang to the head, or alternatively, as a sequel to a labyrinthitis, they can fall off their perch, so to speak. They're then within the fluid system of the inner ear, and over a period of time they deposit, and they tend to deposit where gravity pulls them to. So this is most frequently the back canal of the inner ear, and if enough of these crystals accumulate together, they actually block this back canal, and it means that certain head movements which are in the plane of this back canal will trigger the vertigo.
Okay, and the manoeuvre just sorts it out.
And the manoeuvre allows these crystals to fall slowly, again with gravity, back through the 180 degrees that they need to travel to get out of the open end of this canal and back into the chamber called the vestibule, where they can actually be reabsorbed.
Fascinating. Thank you. I hope that's been helpful to Jane and Jack and Christine, and indeed others who think this may be their problem. Let's go to Gordon now in Eastbourne, who has got giddiness. Tell us a bit more, and have you had treatment?
Well, actually, it first occurred with labyrinthitis 3 years ago. It was on Boxing Day, so it's a day I remember well, and it was quite distressing. But after analysis by my doctor, I was given a course of antibiotics, which cleared it up pretty quickly. But it took me 3 or 4 months to learn to really walk again and retain my balance properly. And since then, it's improved generally throughout. But recently, after some 3 years after that happened, I went on holiday to Mallorca, and I flew there and back. And when I got back, I noticed within 24 hours of returning that I was feeling quite woozy and my balance was slightly affected. And it got quite bad after 2 or 3 days, but I put it down to the fact that I'd been at high altitude in a pressurised aircraft. But since then, this wooziness has been with me all the time. There's no loss of balance, but occasionally I will get up and go to walk forwards and lurch slightly to one side, if you know what I mean. That's about all I can tell you so far.
Well, that's quite enough to be going on with, and a helpful description perhaps for you, Rosalyn.
Yes, it's quite a typical story, I would have to say, Gordon. You describe a very unpleasant illness about 3 years ago when you said it was a most distressing Boxing Day. You took several months to recover, and it's during that recovery period that the brain does its adjustment to the impairment that you acquired on Boxing Day or around about that time that damaged your inner ear balance organ. And I think it's worth remembering that although the brain is magnificent in its capacity to repair and adjust and recalibrate, it's vulnerable, and there are certain situations in which that process of compensation can break down. And it sounds to me that since your holiday, you've decompensated slightly. I mean, as you say, you haven't got the full balance story back, but you do lurch occasionally to one side and you feel woozy in the head. I would have to say that I think you're a good person to go and have some balance exercises and clear this up completely.
So this compensation for what's happened in the inner ear, the infection or whatever has caused the labyrinthitis, then this is the treatment to get your brain to sort of cope with it. Is it as simple as that?
It is. It is. I mean, clearly the actual mechanisms are far more complex, and we don't have all the answers. But yes, the brain is amazingly plastic and can remould, restructure, however one likes to think of this conceptually, and make sense of change signals from the one damaged ear. And after a while, it accepts those signals as the new normal.
Hope that's been helpful, Gordon. If I may, I'll just move to another email from Lisa, who has also labyrinthitis. She's pregnant. She's wondering whether this is going to get worse or get better, or whether it's going to change in any way, and how long it's going to last. Will it follow her through the pregnancy and beyond? One wouldn't like the idea of having a small baby and losing balance.
No, absolutely. Hormones certainly do seem to trigger dizzy problems. They're obviously not the underlying cause. And somebody who's had a problem like Gordon, who's had a labyrinthitis and has recovered by a process of compensation, may then become vulnerable in the premenstrual period or sometimes the first few days of the cycle. And in those situations, again, we find that the balance exercises do help. In Lisa's particular situation, she does just need to watch out that when the new baby comes along, that wherever possible, she can get a good night's sleep. The tiredness is also a trigger to the brain not remaining well compensated.
And if I may throw in another email from Veronica, who says that her husband has inner ear problems. Is it okay to fly? Now, Gordon said that he thought this had perhaps been brought on by flying. Is flying a trigger for these symptoms if you already have that problem? Or could it, in fact, cause a problem of the inner ear?
I think these days there is no question that the flying itself causes the problem. The cabins themselves really are not very different in their pressure to ground ambient pressures. I think the issue...
So you're saying it doesn't cause the problem?
It doesn't cause it. What can happen, though, is that if somebody's eustachian tube, which is this tube that joins the middle ear to the back of the throat, doesn't open and close easily with swallowing, then you can have a build-up of pressure in the middle ear, and that can have a knock-on effect on the balance, and the dizziness can come back. So we do advise anybody who's about to fly, who has a dizzy problem, to consider taking a decongestant before they fly to make sure that they can open and close that eustachian tube properly.
Thank you. We'll go to Rosemary Kirkbride, who's been having funny turns for a number of years. I'm wondering if this could be connected with inner ear problems. What makes you think it might be, Rosemary?
Yeah, hello. It's the dizziness and nausea that I get with it. But unusually, it always occurs in the early hours of the morning. It always wakes me up. I don't get this problem during the day.
Okay. Enough to be going on with,
That's
Rosalind?
interesting. It sounds like you've had it for some time. Only occurs in the early hours in the morning, but sufficient to wake you up.
Oh, yes.
Do you actually spin? You feel very poorly. Do you spin? Does the world zip off to one side and rotate?
It does as soon as I get out of bed.
Yes.
I wake up feeling very poorly with a rapid heartbeat and
Right.
sweating profusely and feeling very nauseous. And as soon as my feet hit the floor, then everything does spin. And I have been known to sort of actually pass out on the floor very, very momentarily, but it has happened.
It does sound quite dramatic. It does sound also as if you have had some investigations already.
I have, yes.
Yes. There are several different things that come to my mind, and I would certainly, with you sitting in front of me, want to explore some of those ideas a little bit further. I think probably what I would say in this situation is that where there isn't a relatively straightforward explanation, you do need to be in the hands of somebody who is medically trained to look at the other causes of balance disorders. And perhaps this might be the moment to also say the rapid heartbeat needs looking at. I mean, whether this in itself is a palpitation due to you being very anxious because of a very unpleasant symptom of dizziness and nausea, or whether in itself your heart has just decided to beat a little faster. And I would want to explore that a little bit further as one example for all of this.
Thank you very much. I think we might have to leave that there. Let's go to Marilyn, who is in North Oxfordshire and has had Ménière's disease for 2-3 years, and looking for some advice today. Thank you for ringing us for some advice. Anything in particular that's puzzling you and that we might be able to help you with, Marilyn?
Yes, I wonder if there's any way that I can stop it once it starts. If I have a vertigo attack, for example, all you can do is go to bed and leave it. And they have given me a hearing aid, but I do have a lot of noise in the ear, and most of the time it just amplifies the noise that's in the ear and doesn't help very much. Is there anything else I can do?
Yes, of course. You described quite an unpleasant aspect of Ménière's, is that the hearing impairment, when amplified with a hearing aid, can actually become rather a tinny sound, and some patients with Ménière's don't find the hearing aid particularly helpful. But again, we've got better hearing aids all the time with the digital hearing aids, and we're able to be more specific in amplifying people.
Rosalind, obviously you will know, and clearly Marilyn, our caller, knows that the hearing loss seems to be part and parcel of Ménière's disease. Yes. Can you say a little bit more, however, what Ménière's would give you that?
Ménière's is due to raised pressure in the inner ear. Houses not only, and there is some sort of words that normally exist in the inner ear as a Ménière's symptom, buzzing noise in the ear, what we call tinnitus. That then develops into this very unpleasant vertigo with very dramatic spins, often with vomiting and very marked imbalance, so that the person has to go away and lie down. The hearing impairment is something that goes on around the same time, and often as the vertigo improves, the hearing comes back to normal and that noise goes away.
But now, you've talked about, thank you for that, but what can our caller do for the vertigo attacks that that are part and parcel of her condition.
Absolutely. Two things I would suggest. One of them is at the level of treating the horrible vertigo as it comes on, and the other is to prevent the build-up that actually triggers the attacks. If I just start with treating the horrible vertigo, there are a variety of different medications that are available to treat symptoms of dizziness. One of these is something that you can put inside your cheek and will dissolve quite quickly that way, and if you're feeling a bit sick, is better absorbed through the cheek tissue rather than through the stomach lining. So that's a good way to help. You may well have tried this if you've had Ménière for a couple of years. We also can recommend a rectal suppository, although the British aren't so keen on rectal suppositories in general, but that's something else that we could do. But I would want to also look at your salt intake, because we have a very clear clinical impression that patients with Ménière's do much better on low salt diets. So I would say to you, it would be a good plan to stop adding any salt whatsoever to your diet, and also to consider whether or not your GP might put you on what we call a thiazide diuretic, one of the ones that helps to eliminate salt from the body. Salt is associated with a build-up of fluid, and we've got strong clinical experience to believe that this makes a lot of difference for patients with Ménière's.
Okay, if I may bring another caller in on this condition as well. Binny wants to speak to us. She's in Brighton. And you think you know what triggers your vertigo. You know you have Ménière's, but you want to check that with our expert today. So what do you think is causing the actual attacks?
Oh, yes. Well, I'm asking about two particular attacks. Normally I don't know what triggers my attacks, but on one occasion I had a really very bad attack after I'd had my eyes tested, and I wondered if it was anything to do with a strong light being directed straight into the eye, as happens when you're having your eyes tested. The other occasion was after I'd used one of these Echo Minitech hearing aids at the theatre, and after that I had a very bad attack, and I wondered, this was a constant use for 2.5 hours, and I wondered if that had been the cause of the attack.
I think there's always the question, was this a coincidence in both of these instances, or exactly as you've asked, was it a definite trigger? Yeah. I wouldn't be so sure that either of those was a definite trigger. The strong light in your eyes, I can't see how that would have affected the build-up of pressure in your ear. I mean, the only other thing that we know that regularly triggers Ménière's would be a great deal of anxiety, and it may have been that you were very worried about your eyes, understandably, because eyes are very important to us once our balance isn't working so well.
I'm afraid I'm going to have to stop you there. Thank you very much for that call, Binny, and thank you very much to everyone who's phoned, and to our expert today, Dr Rosalyn Davies, for her expertise on what I think is quite a tricky but important subject. Thanks very much to all who rang with their questions. If you would like to listen to the programme again, you can go to our website. That's at bbc.co.uk/Radio 4. You can also leave us a message there. We're always keen to hear from you about this or any of our programmes. You can get more information by calling our free and confidential helpline. That's 0800 044 044. And join me again, if you will, next Thursday at 3 for your questions on giving and getting best care at the end of life.
Check Up was presented by Barbara Myers, and the producer was Pamela Rutherford.